It's estimated that 69 million people globally sustain traumatic brain injuries each year. And this makes head injuries in children and young adults one of the leading contributors to world diseases. According to Netcare's head of trauma is one of the main causes of disability in South Africa, but it's also one of the leading causes of death in the country. So why does it not receive as much attention as other medical issues like heart disease, diabetes or cancer? Let's cross now to Professor Anthony Figaji for answers to some of these questions. Professor, you're the head of the Paediatric Neurosurgery Unit at the University of Cape Town's Faculty of Health. Thank you so much for joining us. You've received a major grant to investigate head injuries which are so prevalent yet so underreported. Why is that?
Well, first, thank you for the invitation. Yes, we've been given a wonderful grant through the MRC and the Gabriel Foundation to kind of increase our efforts in the research and the clinical aspects of addressing this. And as to why it's under-recognized, I think there may be so many factors that contribute to it. It's always been known as the forgotten epidemic, which is a good way of thinking about it, given the impact of this COVID-19 pandemic currently. And certainly the number of deaths and patients who are disabled should qualify as a pandemic. And the COVID-19 pandemic has completely changed our society. So personally, governmentally, healthcare services, research completely changed in the pandemic. But before COVID-19 and after COVID-19, we were living with and will continue to live with what is essentially a pandemic. It's just not a virus that is transmissible. But our responsibility should be the same. The responsibilities of the public, of governmental organization, of healthcare services, and for research. But somehow what we mobilize as a society to address this is just completely dwarfed by the actual burden. I think part of it is just not a sufficient recognition that we can actually accomplish a huge amount. So in prevention and in better care, through healthcare sector training and services and in research, we can actually make a massive difference to not only avoiding head trauma, but also to the outcomes of patients who have head trauma. And when you look at it across the world, it's not just South Africa, of course, it's globally a major problem. So when you look at global statistics, it may be hard to believe, and people are always surprised by this, but injuries are a greater burden in terms of what's deaths, premature deaths, or what is called disability-adjusted life years, than HIV, TB, and malaria combined, especially for otherwise healthy young people. And somehow as a society, we just haven't mobilized ourselves to address this.
That's startling. I had no idea. I mean, it's not something that I've ever heard before. Car accidents, the biggest cause of head trauma, and Netcare saying it treats twice as many men as women for head injuries. Why is that?
Yeah, so I think one of the reasons that people aren't more aware is that when statistics are reported, it's somewhat buried. So unlike the other diseases or conditions like cardiovascular disease and tuberculosis, injuries are somewhat broken up into different categories through mechanisms of injury. So you'll have road accidents, and you'll have falls, and you'll have interpersonal violence, and you'll have self-harm. And when you combine all of those, especially for people under the age of 50, and it's a little bit more different in South Africa because of the particular burden of HIV and TB, but across the world, it's the major cause of death. And of all the injuries, head injury by far is the leading cause of death by patients who are injured, and the chances of them having a disability if they survive, of course, is very high. Why does it predominantly affect men? A large part of that is behavioral. So when you look at behavior on the roads, and when you look at interpersonal violence, and even when you look at children, risk-taking behavior, there's definitely a higher risk to males. And you see that in statistics all over the world. But for example, if you look at our children with severe head injuries, so these are patients who the head injury is severe enough to put them in coma, about 65 to 70% of them are boys. And that's even in children.
And I can relate to that with two boys who play cricket, rugby and soccer. That's Professor Anthony Figaji. He's the head of the Paediatric Neurosurgery Unit at the University of Cape Town's Faculty of Health.